My name is Kathy Osuna, and I'm both a registered nurse and a registered dental hygienist. And as a registered nurse, I had had some chiropractic work before, but had never had the kind of treatments I'm getting here. As a hygienist, I had done a lot of compensating, especially for the older people that I had, in leaning over when they couldn't turn their heads and adjust for me. So I found that I was developing a lot of problems with my right hip especially, my right knee and my right leg, and my neck, and also sometimes in my shoulders. And so I finally came to Dr. Jankowitz, I'm pronouncing that correctly,
yeah.
right?
Mm-hmm.
And started care with them, and within the I think it's been 3 weeks, I'm not having any more shoulder pain, I'm not having any more back pain, no hip pain. My foot is feeling 100% better, and I'm not having knee pain anymore. I'm sleeping really well now. Before I was waking up 2-3 times a night because I was having to flip over because the hip would start hurting. I'm not having that anymore. I'm sleeping right through the night and find myself in the same position I was when I went to bed. So I'm getting a whole lot better sleep. I feel like exercising again. It's really made a huge difference in my life. So
That's awesome.
I'm very excited to start sharing that with everybody. The other thing is, as a hygienist, we get a lot of people in that have TMJ problems. I've never had TMJ problems myself, but my daughter is a grinder, and she does use a bite splint, but she still gets that TMJ problem. And I'm anxious to bring her in and have you look her over and start seeing what you could do for her. Hopefully, if we get really good experience with that, I would like to share that with my patients also, because a lot of times the conventional therapies don't work for them. And if they had that option, that might keep them from having to go to the next step, which could be the oral surgeon. So I'm very excited about the whole process.
And then for people who do chairside work, or nurses who are on their feet all day, and then hygienists, because you know both perspectives, what advice would you give them about chiropractic care? And
Oh, I would definitely think they should seek it, and seek it on a regular basis. We contort our bodies into all different ways we're always trying to help the patient.
Mm-hmm.
We're always thinking, okay, I can do this because of the patient. But you have to remember that you have to take care of yourself before you can take care of other people. So I think the regular care is going to keep me in better shape to be able to take care of the people
awesome.
I can have a longer career.
That's right.
So,
an enjoyable career too.
Yes.
And then what would you say makes Synergy Oviedo Chiropractic special for you?
There's a couple of things. You guys are so nice. Everybody is so welcoming when you come in. You took your time to really explain the entire process. And I had two things. I'd always had been manipulated completely before, and you guys use a combination depending on what's going on
That's
with
right.
you.
Depending on the needs.
Yes, and I know a lot of people don't like to be manipulated, and when you don't get that manual manipulation, the instruments, I had the instruments for the first 2 weeks and still got really good results, and then we advanced from that to the manipulations, and that was great for me.
Awesome. So the transition, using the right tools for what the patient needs at that time.
Yes,
That's
exactly.
Awesome. Well, thanks so much for sharing your story. I appreciate it.
I'm thrilled.
And I'm just
to be
so
able
happy
to.
about your healing.
I am too. Thank you.
Onward and upward. Thank you.
Appreciate it.